In both professional and amateur sports, no injury is less understood than concussion, and few are as catastrophic. In recent years, extensive media coverage has begun to focus on these injuries, which were previously dismissed or ignored. Injuries which, in fact, may lead to serious long-term brain damage. In this video, we review recent progress in the understanding of traumatic brain injury, as well as the ongoing research into diagnosis and treatment of this incredibly common and unfortunately seldom recognized danger. Traumatic brain injury is a major cause of death and disability worldwide, especially in children and young adults. Brain trauma may occur as a consequence of focal or diffuse impact upon the head by a sudden acceleration-deceleration within the cranium. MTBI can alter the brain's physiology for hours to years, setting into motion a variety of pathological events. These may include impaired neurotransmission, loss of regulation of ions, deregulation of energy use and cellular metabolism, and a reduction in cerebral blood flow. Diagnosis of MTBI is based on both physical and neurological examination findings, duration of unconsciousness, usually less than 30 minutes, if applicable, and post-traumatic amnesia, PTA, usually less than 24 hours, if applicable, and the Glasgow Coma Scale. MTBI sufferers have scores of 13 to 15. Neuropsychological tests exist to measure cognitive function, and the International Consensus Meeting in Zurich recommended the use of SCAT-2 test. Such tests may be administered hours, days, or weeks after the injury, or at different times to demonstrate any trend. Increasingly, athletes are also being tested pre-season to provide a baseline for comparison in the event of an injury, though this may not reduce the risk or affect return to play. Although no structural brain damage occurs according to the classic definition, some researchers have included injuries in which structural damage has occurred, and the National Institute for Health and Clinical Excellence definition includes physiological or physical disruption in the brain synapses. Various organizations such as the American Congress of Rehabilitation Medicine and the American Psychiatric Association have defined MTBI using some combination of loss of consciousness, LOC, post-traumatic amnesia, PTA, and the Glasgow Coma Scale, GCS. Recently, the use of anti-inflammatory drugs for the treatment of concussion has been closely examined, as it is now becoming more evident that lingering neuroinflammatory mechanisms contribute to the secondary damage following a concussion. The use of nonsteroidal anti-inflammatory drugs, NSAIDs, seems to be an attractive option. However, it has been shown that chronic treatment with ibuprofen, one of the most commonly used NSAIDs, worsens the cognitive alterations in rodents exposed to an experimental TBI. Other NSAIDs, such as minocycline, are capable of reducing apoptotic damage in several forms of CNS injury, such as spinal cord injury, but do not show any beneficial effects when examining recovery times from mild TBI. Taken together, these data demonstrate that preventing an inflammatory response to a concussion is not a viable treatment, despite its effectiveness in treating other traumatic injuries occurring in the CNS. Furthermore, this evidence suggests that the concussed brain presents a unique inflammatory signature as opposed to a general inflammatory response that occurs following any CNS injury. Measurement of predictive visual tracking is also being studied as a screening technique to identify mild traumatic brain injury. The visual system is often significantly affected by concussive injury. In some, symptoms of visual dysfunction may resolve in a short time frame, while in others, symptoms may be ongoing for weeks or even months. Athletes need to be more aware of concussions so they can receive proper treatment and stand a better chance of recovery, especially from more concussions that might occur in the future. Questions about concussions and their effects on athletes are all over the media today. The answers, however, are not. It is our hope that continued research into this common injury will lead to better means of both prevention and treatment and provide a brighter future for individuals suffering from the long-term consequences of brain injuries.